Addressing rising healthcare costs is a challenge for politicians, families, and businesses. In 2017, a law was passed which assesses businesses a healthcare fee called the Employer Medical Assistance Contribution Supplement. It's designed to address the rising cost of MassHealth, but some say the fee is putting an unfair burden on small businesses. Carolee McGrath sat down with Jon Hurst, the president of the Retail Association of Massachusetts, and Judy Herrell, the owner of Herrell's Ice Cream and Bakery in Northampton, to learn more.
Well, the EMAC was designed as a patchwork funding mechanism for the state Medicaid program, MassHealth. 2 years designed to raise about $300 million or so each year to help out funding on Medicaid. The problem is those that are getting hit with this cost, this tax, $750 per employee in many cases, they also are the ones, they're small businesses that have the highest healthcare premiums in the entire state because of the way the risk pools work in Massachusetts. They're putting in the same risk pool as individuals. So small businesses cross-subsidize individuals. Now, with this EMAC, they're being asked to subsidize MassHealth, the Medicaid program. It just isn't fair, and it's disproportionately hitting these small businesses.
So this is for an employee who goes on MassHealth who...
Well, not only MassHealth, but also the connector, which isn't even Medicaid money. So the disconnect there, it really isn't fair. It could be someone just buying through the connector or exchange through the ACA, and that's not Medicaid dollars at all.
So how is this impacting you? You're a small business. You have a lot of young people, I'm sure, working for you.
Right.
So what does this mean to you?
It's a real burden. The way it's working for us is, let's say, for example, I have an employee that's working full or three-quarter time. We offer them our health insurance once they hit a 90-day employment. They are smart individuals. They say, I can't pay half of almost $900 a month for a premium, which is outrageous, and that's what we have to charge because that's what the premiums are for an individual. So they go to the connector. The connector says, oh, we'll do this whole thing for you for $350 and we'll subsidize you. So we have offered them the insurance. They have rejected it. They would only have to pay half. They take the subsidy, they do it with the connector, and then the employer is charged back up to $750 for their subsidy. Now, I have this week 23 employees. We're getting whacked. It's like $1,500 per quarter, sometimes $2,000, depends on how many hours people work. It's a very complicated equation that they're using to calculate. We can't figure it out. We also can't say to them, are you on MassHealth or what insurance do you have? So we have no way of knowing what we're going to get hit with quarterly.
So this is per quarter. So if you have one employee working there now, leaves, and then you have a replacement, you're paying another fee for that replacement.
That's correct.
As well.
And on top of that, let's say somebody works one day, we're going to get hit. Let's say that same employee has another job, part-time job. They go to that employer is getting hit for the same employee.
So how do you work this out, and who do you how do you explain to lawmakers that this is really a struggle, for small businesses?
We're coming on shows like this. We're talking to chambers, we're talking to small businesses. We're educating them that, look, the EMAC on top of the highest health insurance premiums in the country, they literally are, on top of $15 minimum wages, on top of paid sick leave, on top of paid family and medical leave. It's just overwhelming. There's only so many payroll dollars that a small business has in order to put out there and stay in the black. Keep your doors open. They're stretched so thin, and this is something that, to no fault of their own, government created this incentive for Judy's employees to go to the connector to get cheaper health insurance. Why should government then come back and tax her multiple times per year for the same position? I mean, if she had an employee that worked for 12 months and she just paid $750 for that one person, maybe that's a little more affordable, but maybe she has 3 people throughout the year, that all three get assessed $750. That just isn't right.
Right. What are you hearing from other businesses that you're in
Same
touch with?
Same thing. Everybody, and some business owners that I know own, let's say, 2 or 3 restaurants. The restaurant industry employs the highest percentage of employees. We're the employer. Restaurants, if you're making between 4 and 6% profit, you're doing all right. Guess where this is cutting? I mean, look at it from a different point of view. My sales are flat this year. It was a very hot and rainy summer. So my sales as an ice cream store were flat. But my expenses have doubled. And they're because of mandates from the state. If I go below 4%, there's no reason for me to be open. I think you're going to see closings.
So I know that, and we've talked about this before, obviously you want people to have health insurance, to have that coverage.
Absolutely.
I know that from your political views, that's where you stand. But to maintain it is a whole other piece of work. How do you explain this to others, and how do you fix it?
I don't know how to fix it. No matter how you look at it, whether it's single-payer health care, whether there's some sort of money from the government to subsidize, whether there's problems with every, potential solution. But the way it is now is not sustainable. It's simply not sustainable.
I think part of the problem here is that we have public policy individuals that have no clue what it's like to be in Judy's shoes. I mean, they get their health insurance through the Group Insurance Commission, which is this huge buying pool for all of the state employees and municipal employees. They don't even know what it's like to be under a high deductible plan and with high copays and so forth. They have Cadillac plans funded by the taxpayer. They really don't understand what it's like for a small business, to operate under the rules that they have created. And the discriminatory rules. We need for our public policy leaders to really better understand the plight of these small businesses.
And what about the waiver program? Is that something that's...
We filed for the waiver program. We didn't get the waiver. It's like doing your end of year, math, your end of year business work for taxes to just fill out the waiver. It's like a ream of paper. It's ridiculous. And it takes forever. You have to get an accountant to do it with you or your bookkeeper to do it with you. So you're paying somebody else to help you do it. And then, you don't get it anyway. It's very arbitrary. The other thing that's been on my mind about this is that for us, we offer what is considered a Cadillac plan. Because in order to reduce the cost of the health care for the people that work for us, the deductibles make it so they'll never reach the deductible. And every year the insurance goes up and it covers less. Also, what we're able to get for insurance is very different. Even though it's the same companies as the connector, it's different than the connector. A perfect example is on our policy for physical therapy. Physical therapy on our plan gets 30 visits per year, flat. The connector's policies are 30 visits per prescription per year.